How's it, guys? Welcome back. Ready for chapter 11, Trunk Calls. The Healing Arts. Learn from the hornbill, the bird of unconquerable hope. No matter how bad the drought, no matter how desperate the famine, the hornbill always holds its head high. Its beak points towards a better tomorrow. Never be like a crow whose ugly beak points earthwards in pessimism. Be ever like a hornbill, my child. Zulu instruction to learner healers. I was in a very compromising position in Dr. Tat's office. My pants were on the floor. A nursing sister was standing next to me with a tray of swabs. I was bent over and had just received the most painful injection of my life, in a spot I hate to mention. I turned around to see what Dr. Tads was going to do, and he said, "This won't hurt much. I'm just going to nick them with a scalpel, and that should relieve the pressure." Suddenly the reality of what he said struck home, and without a thought I scooped up my shorts and ran out of the office, and through the full waiting room onto the corridor that runs outside all the medical offices. I slowed long enough to pull on my shorts, and then continued my escape. A nurse shouted at me to come back, but I was well on my way. No way I was ever gonna let anyone put cold steel to that part of my anatomy. I had heard of a herbalist who lived up at the Gwai from old Melvin Sparrow, and that was where I headed. I got to the Gwai siding and asked the first person I saw there where the Isanus lived, and they pointed me in the direction of his village. When I arrived, I made the traditional greeting and then sat on a stool, making small talk while the herbalist until I saw he was ready to talk business. The white doctor wanted to cut me on a very private part, but I refused, I confided. "For circumcision?" he asked. "The Umdidi," I replied in almost an undertone. "Ah!" he shouted with glee. "You have piles!" And he was laughing as though it was the funniest joke of the week. I sat looking at the pale Kalahari sand at my feet. "Come with me. I will show you what to use whenever you have this problem." He rose and went striding out of his village, a young boy following with a hoe. After walking a while, he found what looked like a fern and instructed the boy to dig out the root. The botanical name in Latin is Elephantina elephantoriza, or Nkwani in Ndebele. There is, however, no common English name for it. The boy had obviously done this before, because he expertly dug out a long, thickened root, which looked a lot like a sweet potato, except a lot longer. The herbalist explained to me how I must take a piece right now, put the bitter root between my cheek and the upper and second molar, and just gently suck on it. I did as I was told and experienced the bitterest pucker of a lifetime. "You will be better by the time you get to Bulawayo, and this root will cure sore throats, ulcers of the stomach, and anything to do with the intestinal tract," he informed me. "How much do I owe you, Ndala?" I asked, showing respect. As you are only the third white man I have ever had as a patient, it is nothing." He smiled at me, scratched his backside, and then laughed at me. He was right. By the time I got to Bulawayo, all the pain was gone. By the time I showered that night, there was no sign of the trouble. Since then, on the herbalist's advice, I've eaten one piece a month and have never suffered from that problem again, curing scores of others with the same root. I also had the opportunity to give it to a friend of mine who was suffering from a severe bleeding stomach ulcer, way out in the bush, miles from any help. He hadn't been able to eat in the past 3 days, with continual vomiting of blood. An hour after giving him the root to eat, I had him eat a meal. Not only did the meal stay down, but all signs of bleeding stopped immediately. If his stomach puckered the way his face did, it's no wonder it works so well. When we first went to Buha in 1948, it was very primitive. The Waha were renowned drinkers, to the extent that when the Queen came to visit in 1954, every tribe came forward with their speciality, but the Waha impressed Her Royal Highness with how much each man could drink. Beer making was a festive occasion. Beer drinking was an art. Beer was a commodity to be used in trading, weddings, funerals, or anything of importance that might be happening. Dad ran and administered an 80-bed hospital as the only doctor. He had very little time to relax, so most of his play used to take place at the hospital. Most of his play was directed at the men who had received injuries due to their drunken state. The men would fall asleep on the way home after a beer drink, and a hyena would come along, and the first bite they would take would be out of the scrotum. This would wake the man up in a hurry, and the hyena would also run away. All the patients knew what Dad thought of men coming into the hospital to sleep off their hangovers and have their scrotums sewn up. They would wait in anticipation for early morning ward rounds. They would whisper between themselves, wondering what the white witch doctor was going to use today to heal the drunkard who was snoring soundly. Was it going to be the rubber snake? Was he going to dance? If they had known about betting, bets would have been made on what this crazy man was going to do. On this particular morning, I went down to the hospital with Dad and my constant shadow Buster, my 90-pound bull terrier. I had heard the story about the drunk man and wanted to see what a hyena bite looked like. We walked into the ward together, and Dad immediately greeted everyone in Kiha. Bagakeye urakumeye. Good morning, how are you? And without missing a step, walked straight to the patient I so badly wanted to see. Buster, come. I want you to examine this patient, he said, patting the foot of the bed. Buster immediately jumped onto the bed and walked up to the patient's head. The patient felt this thing walking on and next to him, and pulled the blankets back from his head and looked into the face of a white monster that had pink eyes and a face like a pig. With a shriek, he leapt out of bed and ran down the length of the ward out into the early morning sunshine. Buster still stood on the empty bed, and the whole ward was shouting, hooting, clapping, and congratulating Dad on an immediate healing. Dad taught me how 80% of illnesses are psychological. He would examine the patient and determine that nothing physically was the matter with them. Then he would give them an injection of sterile water and tell them they were better. This would satisfy them, and even though they had been brought in on a stretcher, they would stand up and walk home. Others took more persuading. A very small piece of sodium put in a urinal always had dramatic effects, as soon as moisture hit the sodium. Always had dramatic effects as soon as moisture hit the sodium. Smoke and a hissing sound would come billowing forth, convincing the patient that all the unhealthy bugs had left their body. Other times, colored dyes would do the trick. In a serious tone, Dad would say that if the sample would remain yellow, they were still sick. But if any other color, then the sickness had left the body. The looks of surprise when blue, green, or red urine was poured out was enough to heal anyone. After the fine example Dad had set, it wasn't hard for me to heal people when the sick were brought to me. I had had 17 years of watching Dad put his hands on people, thump their back, look in their mouth, pull down the lower eyelid, check for jaundice, palpate the liver. I'd then give them an aspirin and tell them that they would be better by the following day. And what's more, they would be. Ndlovu brought me his wife, who had not walked for 3 months when I was prospecting in the Sanyat Sen area. I carried with me a small kit for checking gold, a small Pyrex dish, a bottle of concentrated nitric acid, and an eyedropper. Boss, can you cure my wife? Ndlovu asked. I can, I replied, but I need a goat to feed all of us. This is a good trade if you can make my wife walk. He beamed at me. I had noticed right away that she had small holes in the top of her foot, and figured they were putsy fly larvae in there. Yeah, I've had that before. Like a little grub. Yeah, little fly larvae. The flies lay their eggs on wet laundry, and then when you put the clothes on, if you haven't ironed them before to kill the eggs, then they hatch, and the grubs bury into your skin. It's very, very itchy. I checked to make sure that there was putsy fly larvae in there. A drop of acid will kill them immediately. I checked to make sure there was water, and noticed a stream about 100 meters away. Taking the eyedropper, I quickly put a small drop in each hole. It sounded like a siren starting up, and then the wife took off. An Olympic sprinter could not have reached the stream quicker than she did. She washed the acid off her foot, and her days of not helping her husband were over. Tommy Orford was telling me of a miraculous healing he performed in the past. On his way through the bush, he found a man lying by the side of the road, dying. He had been bitten by a common night adder, also known as the rhombic night adder, because of the rhomboid patterns on its back. They are only slightly cytotoxic, but do cause a bit of swelling and pain. Tommy knew that no one died from a night adder, but he had heard that a strong electric current can neutralize poison. He took a cattle prodder and hooked it up to the battery of his truck, pulled the man's trousers down enough to expose his buttocks. He put one prod on each buttocks and pulled the trigger. The man, from a face-down position, jumped up so fast that he split his pants and ran off down the road for 100 meters before he came to a stop. By that time, everyone, including the patient, was laughing and very pleased with the effects of the new medicine that had been discovered. When I asked why he hadn't put the current on the snake bite, he replied, "Oh, I never thought of that at the time." A student from Tanzania, studying at Solusi University, came into my dental office. She told me of excruciating pain in a top molar. First it was the second molar, then the first molar, then she thought it might be on the other side. I took x-rays and saw no problem, but did think of what Dad had taught me about the art of healing. I took my index fingers and felt along the maxilla, working my way back to the temporal mandibular joint. I then took a sandpaper disc and gently sanded on some old fillings. During this time, I spoke to her in Swahili, her home dialect. We spoke of mandafu, the green coconuts that give women large breasts and men a greater manhood. We spoke of the food that was common to both of us, the orange palm nut oil, dried sardines, cassava, boiled green bananas, wild fruits. With the mention of each dish, we were transported back and laughed together. I sanded bit by bit for another 20 minutes, polishing each old filling. I assured her that she would never have another problem, as I had fixed it completely. I heard her telling Mrs. Webster, the receptionist, that she hasn't felt so good since she left Tanzania. Aside from all the nonsense, the most important thing Dad taught me was to listen and be sensitive to patients' needs. Doctor means teacher, and if you're a teacher, you have to be patient, Dad would counsel me. In his office was a marble statuette of a ballerina. On the walls were pictures of ballerinas as well. My sister told me of women patients who had come in with breast cancer and had been referred to Dad to have a mastectomy. They would speak of the stigma of having no breast and of how it would affect their life. Dad, in his gentle way, would ask them who they thought was the most graceful of all women. They would all point to the ballerina statuette. Ah, and have you noticed that these graceful creatures all have no breasts? He would ask. It's no wonder he was loved by students and patients alike. Alright, that's it for tonight. Hope you enjoyed. Sleep well. And check you tomorrow. Cheers.